Hello, my name is Viet Pham, and I will be reviewing the systemic healthcare operations here in the U.S. As we look at it today, $7,000 is spent on healthcare, and this will increase to $12,000 by the year ending 2015. This translates to a $4 trillion spent on healthcare by year ending 2015. Since 1970, healthcare spending has grown at an average annual rate of 9.9%, or about 2.5 percentage points faster than what the gross domestic product is growing at. Healthcare expenditures will be 20% of the gross domestic product of the U.S. by year ending 2012. What is the impact? Budget cuts will be put in place on education, the military, and other services. And also the ability for the U.S. to compete globally as the more healthcare dollars are spent versus money spent on productivity. When we look at the U.S. landscape in 2012, chronic disease is still very prevalent when we look at diabetes, cardiovascular disease, and obesity. Hopefully we'll get to the underlying reasons why this is occurring, but the point is chronic disease is prevalent. Hopefully we have moved towards alignment of hospital and physician incentives, a focus on quality we put in place, as studies find no systemic relationships between higher spending and longer lives or higher quality of care for Medicare beneficiaries. Some analysts have even found that spending more is associated with slightly lower quality. When we look at the Medicare population, 14% of the population will be over the age of 65. Medicare Part D enrollment will increase. Technologies will be used to reduce health care spending. Technologies such as electronic medical records, so greater access to healthcare coverage. The uninsured will be insured. This will be done by the affordability of premiums and also the additional options for healthcare services. When we look at the private system, paid-for performance-based metrics will still be used, as well as the HMO model will still exist. Patient incentives to live a healthier lifestyle, to reduce premiums, will also be put in place. We will also need to address the barriers to access of products and services for low-income patients as well as the indigent population. Administrative costs will be addressed. If the U.S. has spent what countries with mixed and public and private insurance systems such as Germany and Switzerland spent on their insurance systems administrative costs, it could have saved $32 to $46 billion a year. Since the private sector purchases about 30% of the pharmaceutical market, cost transparencies will be prevalent. Strict formularies will be used for the increased utilization of generic products. Also, the emphasis of step care will be used to curtail the high cost of health care. Step care is when patients are disease treated first following guidelines, using low cost resources and then reaching higher cost resources. When you look at the public model, Medicare and Medicaid will still be available. However, the decline of Medicare Part A will still need to be addressed. Cost transparency for drugs again will be addressed. The government purchases 60% of the pharmaceutical products out there. The ability for the government to negotiate pharmaceutical industry will be used, as the Medicare Prescription Drug Price Negotiation Act will be put in place. Price transparency. In 2012, the consumer or the patient will have some clarity on why they pay a certain price point for their medicine. As it is today, drug manufacturers negotiate with the wholesaler, the pharmacist, the pharmacy benefit manager, as well as the insurance companies, using a very complicated formula and very different formulas for each buyer. In 2012, that will be eliminated and be one very simplified formula for each buyer, thus getting the drug to the consumer or the patient at a certain price point. That will give them the understanding of why they are paying a certain price. In closing, the U.S. healthcare systemic operations, many efficiencies will be identified and strategies will be developed and implemented to address those problems. However, future leadership will be needed to guide the healthcare market back to sustainability.